to my pulmonic, going down to my third intercostal, left sternum border, my urge point where I would hear my murmurs better. And then I'm going down to the fourth intercostal, the tricuspid area, on the left sternum border, fourth intercostal, fifth intercostal, left mid-clavicular. I'm listening for my fifth, my mitral area. I'm going to come back up and I'm going to turn my stethoscope and I'm going to listen to murmurs, starting at my fifth intercostal, mid-clavicular, coming up to my fourth intercostal, left sternum border, my urge point, which is third intercostal, left sternum border, my second intercostal, left sternum border, pulmonic area, and going to my right, second intercostal, right sternum border. No murmurs audible. I'm going to feel for my heave and my PMI. I'm placing my fingers over the herbs area. No heaves or thrills noted. I'm checking now my PMI. My PMI is within normal limits. Fifth, mid-clavicular area. I could hear my S1 very well at my fifth mid-clavicular area, and I could hear my S2 well and my second intercostal right and left sternum border. I could hear S2. Now, if I wanted to listen for S3, left S4, I would ask my patient to turn. I'm going to ask her to turn now to her left side. And I'm going to listen for S3 and S4. Thank you. No S3 nor S4 audible. No adventitious. No extra heart sound noted. While my client is laying to her side, I'm going to go on and auscultate her lungs posteriorly. You just breathe in and out for me. I'm starting at the top, going across, down, across, down, across, down, across, going laterally, checking my lower lobes, okay. There's no adventitious sound noted. I check my upper and my lower lobes posteriorly and laterally. And while she's on her side, I'm going to check for the excursion, and I'm going to check for tactile firmament in the back. If you take a deep breath. Thank you. Good, long excursion. I'm going to check for tactile firmament by her repeating 99.
99, 99, 99, 99, 99, 99,
Okay. No tactile fremitus noted. And while she is aligned, I'm going to go on and percuss her lung for consolidation. I'm going to use my third finger and tap with my third finger. Only my third finger is going to be on her chest. Okay. There's no consolidation noted. I'm just checking her ribs now. Okay. If you turn back, I'm going to, right now, I'm going to check her abdomen. I'm just going to cover her. Okay. Now, I'm going to go in and auscultate her abdomen. First, I'm going to inspect. Abdomen is somewhat protruding. And I'm going to start at my right lower quadrant. Bowel sounds palpable, audible, in all four quadrants. No hyperactivity noted. I'm also going to auscultate for aorta bruit, and I'm using the bell of my stethoscope. I'm also going to check for a bruit on my left side, my right, going down for renal, and femoral. No audible bruit noted. And while my client is lying, I'm going to go on and check for her carotid bruit. I'm going to ask you to hold your breath for me as I move with the bell of my stethoscope down the carotid artery. Would you hold your breath? Breathe out. Again. Hold your breath. Breathe out. Okay. Again. Hold your breath. Breathe out. Hold your breath. Breathe out. Okay. No carotid bruit noted. Okay. I'm going to now do light palpation and deep palpation, and then we are going to percuss. Okay. Let me know if you feel any pain or tenderness. Any pain?
no,
Any tenderness?
no,
Any pain or tenderness?
no,
Okay. No pain or tenderness. And I'm going to now do deep palpation. Let me know if I'm palpating, I'm going about 5 to 7 centimeters, feeling for mass and lumps. Any pain or tenderness?
no,
Any pain or tenderness?
no,
Okay. I'm going to go on and I'm going to do percussion. I noted tympanic sounds in the abdomen. I'm going to percuss for the liver now. So I'm going to start a little below the umbilicus and the mid-clavicular on the right, going up to where I hear dullness. Dullness noted. I'm also going to start at the nipple and come down. Dullness noted. I'm also going to now just palpate for my liver. I'm going to put my hand underneath your right side. Okay? No borders of the liver noted. I'm also going to check and palpate for my kidney, my right kidney. No kidney noted. I'm going to also palpate for my spleen. Now I'm going to percuss for my spleen. Some dullness noted. Borders of the spleen didn't appear to be abnormal. Now while my client is lying, I'm going to go on and do teach her how to do a breast examination on herself. Okay? Ms. Moore?
Yes.
What I would like for you to do is raise your hand above your head. Okay? And starting from the inside, we're going out. And I would like for you to do this every month. If you are postmenopausal, then just select a date on the calendar and do it. But if you are still menstruating, if you would do it the time of your cycle. Okay?
Okay.
Right, so all I'm going to do is I want you to use the tips and the pads of your fingers. We're going from the inside out in a circular motion. And you're going to do light, medium, and deep. Because you want to get any lumps. Okay? We're going to do each breast, going from the inside, arm up, thank you. Outside, using light touch, medium, and deep. Now with your arms up, I'm also going to check for axillary lymph node. And this is what I would like for you to do. Thank you. No axillary lymph node noted. And you are to stand in the mirror and look at your breast with your arms down. You are to look in the mirror with your arms above your head. And you are to lean over and look in the mirror to see if there's any enlargement in it. And you are to check your nipples. So you take your nipple between your thumb and your index finger and you press and look for discharge or discoloration or soreness. Okay? And you need to do that every month.
Okay.
Okay. Now while you're lying here, I want to check your cerebellum function. So I would ask you, if you don't mind, if you would take your heel of your right foot and bring it to the shin of your left foot and bring it down. Okay?
Shin of my left leg.
Mm-hmm. Your left leg, I'm sorry. And do the other one. Thank you. If you would sit up for me now. All right. Now I would like to check your cerebellum function again. So I would like for you to take stretch both arms out and close your eyes and get your index finger and bring it to your nose and alternate that. Okay, the other one. Okay, thank you. I also would like for you to take your hand and I would like for you to bring it back and forth, fast, open, yeah. Okay, very good. We'll check in your cerebellum function, okay, to make sure your sensory cerebellum function is intact. Okay, so what I would like to do now while you are sitting, I'm going to check the strength of your muscles, and then I'm going to check your reflexes, and then after that I'll have you walk and do a heel to toe and do the what we call the Roberg test. Okay? All right. So if you would squeeze my hand. Good. Okay. Now if you would bend your arms up. Okay. Now I'm going to press against them and don't let me push them. You push against me. Now I'm going to try to pull. Good strength. Okay. Now using my my hammer, I'm going to check for your reflexes. Okay. I'm going to check first for your biceps reflex. Okay. Okay. And if you hold your arm out, we're going to check your triceps. Okay. Okay. And now we're going to check your radial. Okay. I'm going to check your patella. Okay. 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 I'm going to check your Achilles reflex. Just hold it down for me. Okay. All reflexes 2+. Within normal limits. Now, if you don't mind, if you would stand for me. If you turn around, and I would like for you to walk heel to toe, right to the end of that table. No, heel to toe. One heel, your heel, and then your foot in front of the other. I'm sorry. Okay, there you go. Other, in front of the other, front of the other. In front of the other. Turn around and come back. Okay. There we go. Thank you. Okay, thank you. Now I would like for you to stand with your eyes closed, okay? And this is called the Roberg test, and I'm going to stand beside you, have my hand in front. I want you to stand here for about 30 seconds with your eyes closed. Good. A no weaving or noted Roberg test within normal limits. Let's check your pronatal drift. If you would stand and hold your hands out. Both of them, close your eyes for me. Okay? For about 60 seconds. Good. All right. So, pronatal drift within normal limits. Good cerebellum and cerebral function. I'm going to also right now check her I'm gonna ask her if, I'm gonna check her costal angle for her kidneys. If you just stand there, I'm just gonna put my hand here. I'm gonna check, there's any tenderness. Any tenderness?
No.
Okay, all right. So if you would just sit one more time for me, I'm gonna check your Babinski reflex. I'm gonna turn all the way around. Turn all the way around, just sit up. Okay, I'm gonna check her Babinski reflex. Okay. Okay. Babinski reflex within normal limits. Ms. Moore? I thank you very much for allowing us to do the assessment, and we will write up a report and we will give you a copy.
Okay.
And I thank you so very much, and you have a good day. I'm
Okay.
gonna wash my hands and leave.
Okay, thank you.